Diabetes is dangerous, destructive, and often painful disease. The older you get, the more likely you are to develop it. Every year, over 1 million new cases of diabetes are diagnosed worldwide. That's why it's important to know the symptoms of insulin resistance. Hello healthy people, welcome back to Nuruveda. Today in this video, we will discuss all about insulin resistance. We will explain what is insulin resistance, how it can be dangerous, what are the symptoms, and how can you prevent or reverse it. So stay tuned for this interesting and very helpful video. Let's understand what is insulin resistance. Insulin resistance is a precondition that increases your risk of developing diabetes. You could be insulin resistant for years without knowing it. Food is broken down into glucose in your body. Then insulin, which is a hormone secreted by pancreas, transports and facilitates its use as energy in cells. Because of several potential contributing factors, sometimes cells in your body don't respond to insulin and can't use glucose from your blood for energy. This results in excess glucose built up in your bloodstream. To make up for it, your pancreas makes more insulin. The more insulin that your pancreas makes, the more resistant your body becomes, and this goes on a vicious cycle. Insulin resistance syndrome includes a group of problems like obesity, high blood pressure, high cholesterol, and type 2 diabetes. It could affect as many as 25% of the world population. You might call it a metabolic epidemic. Now we will discuss some important and noticeable symptoms of insulin resistance. Although sometimes subtle, your body may tell you when it's having a hard time. Here are few signs to look for. Number 1. Brain fog. There is a link between brain insulin resistance and neurological disease such as Alzheimer's disease. Insulin plays a very critical roles in learning and memory. When brain cells are unable to absorb nourishment, their function is reduced, resulting in brain fog and potential loss of memory and cognition. Number 2. High cholesterol. There is a link between chronically high cholesterol and diabetes. Insulin resistance is associated with increased bad cholesterol levels and reduced good cholesterol levels. Cholesterol is synthesized faster but not correspondingly absorbed by cells when blood sugar is high. This condition can increase the risk of cardiovascular events such as heart attack and stroke. Number 3. Hunger. Hormones trigger your body to eat when it's hungry and to stop eating when you have had enough. It's a complex process. Leptin is a hormone that is closely linked with insulin in sensing how much glucose is in your blood. When the glucose reaches a certain level, leptin production increases to tell your brain to stop eating. Leptin and insulin work on opposite sides of the same process and regulate each other. When insulin increases, leptin decreases and vice versa. If there is an imbalance with insulin or cells become insulin resistant, leptin production can decrease and you can constantly feel hungry. Furthermore, it's possible for cells to become resistant to leptin. You feel hungry even if your stomach is full and your blood sugar level is appropriate level. This can lead to overeating and weight gain. The more weight you gain, the less sensitive to leptin your body becomes. Number 4. Hypertension. Insulin resistance has been repeatedly established as a contributor to high blood pressure. When uptake of insulin is reduced, absorption of salt by kidney is affected, resulting in sodium overload and consequential hypertension. This can occur in people that don't have diabetes. Blood sugar levels might be okay, but one of the things that insulin does is open blood vessels. Constricted blood vessels make the pressure rise. Some studies indicate that hypertension due to other causes lead to insulin resistance. Others have found the reverse to be true. It all depends on the individual and many risk factors. But all studies agree on one thing. High blood pressure is an indicator of insulin resistance. Number 5. Lethargy and fatigue. Chronic fatigue is one of the byproducts of diabetes because your body isn't burning energy properly. With pre-diabetes, you can get a surge of energy immediately after eating. Insulin responds by spiking to manage the food intake, then energy crashes. This can leave you feeling sluggish and sleepy. Eating in this pattern over time with insulin spikes and crashes can lead to more insulin resistance. Eating corn oil has been specifically shown to lead to lethargy and the development of insulin resistance. Use grass-fed butter, olive, sesame, coconut and avocado oil instead. Number 6. Obesity and belly fat. The strongest predictor of insulin resistance is obesity. Studies have shown that belly fat produces hormones and other substances that can cause serious health problems such as insulin resistance, high blood pressure, imbalanced cholesterol, and cardiovascular diseases. Belly fat plays a part in developing chronic or long-lasting inflammation in your body. Chronic inflammation can damage your body over time without any sign or symptoms. Studies show that losing the weight can reduce insulin resistance and prevent type 2 diabetes. Number 7. Polycystic ovarian syndrome or PCOS. PCOS is an endocrine disorder in which there is an imbalance of sex hormones, estrogen and progesterone, resulting in a small cyst on the ovaries. Studies have linked PCOS to insulin resistance in almost every case. The mechanism by which PCOS occurs is abnormality in certain insulin receptors. The interaction of hormones in your body is amazingly complex. It therefore makes sense that imbalance in one will result in a ripple effect. Number 8. Skin condition. Have you ever noticed a skin condition in which skin darkens and changes texture to a velvety feel in your armpit, groin, back of the neck, between fingers and toes, or on your elbows and knees? This skin condition develops as a result of insulin resistance. As explained earlier, insulin resistance can trigger liver to produce more insulin. This excess insulin interacts with the skin protein and connective tissue to produce such a skin condition. High blood glucose can also make your skin dry and itchy due to excessive fluid loss and hormone irregularities. Now that we have discussed in details the symptoms and how to identify if you are having insulin resistance, let's find out how to overcome it. Yes, we repeat, insulin resistance is reversible and preventable provided you identify the condition and work your way to fitness. The first and foremost consideration is body mass index or BMI. If you are overweight for your height and build, you are at risk for being a host of illness and disease. The very strong correlation between obesity with insulin resistance and diabetes makes weight loss the most important step. We know it's not easy, but it is necessary for good health. Number 1. Change your diet. Cut out added sugars, processed food, soft drinks and artificial sweeteners. Add vegetables, herbs and fruits. Reduce the carbohydrate you eat, including starches like bread, pasta, rice and legumes. Replace with lean animal or plant protein. Number 2. Exercise regularly. Exercise, even in form of brisk walk, is good for every part of your body and mind. Exercise improves your insulin resistance, and prevent you from dangerous diseases. If you modify your lifestyle by doing only 20 minutes of exercise per day in any form, this can result in stopping the progression of glucose tolerance to type 2 diabetes by almost 60%. Number 3. Minimize stress. Find constructive ways to manage stress. Chronic stress is detrimental to every bodily system. When you are stressed, your body releases a stress hormone called cortisol. This cortisol is known to contribute to insulin resistance. Number 4. Get adequate quality sleep. Not getting enough sleep wreaks havoc on hormones and is known to cause diabetes. If you suspect your body may be developing impaired glucose tolerance, your healthcare provider can test your blood sugar levels to find out for sure. Insulin resistance is a better predictor of diabetes and cardiovascular disease than cholesterol. If caught early, the trend is readily reversible without sustaining long-term damage. By the way, we have made a detailed video on best ways to lose weight, especially around your belly. Do watch that video, link in the description. That's it for today. If you like our video, don't forget to hit the like button. Subscribe to our channel to get the latest update on the videos. If you have any suggestions, write to us in the comment section. Thank you for watching. Until next time, take care.